Good morning, good afternoon, good evening, wherever you're joining us from. Welcome to the Safeguarding Health Professionals Mental Health webinar hosted by the World Health Professions Alliance. My name is Helen von Dadelson and I am the manager of the Secretariat here. We're really happy to have you all on board. Firstly, a little bit of housekeeping. As this is a webinar, your cameras and microphones are turned off, so all you can see are the panelists. To ask questions at any time during the webinar, please use the Q&A button. We've also left open the chat function, so feel free to drop us a line with comments on what you're hearing or saying hi from wherever you are calling in from. If you do have any problems, please write to our colleagues at World Physio, info@world.physio, and they'll be able to help you connect. Now, we have a pretty packed session today, but before we get going, I wanted to launch a poll to get you in the mood. Rachel, could you please launch the poll for the attendees? When was the last time that you genuinely discussed with a colleague how they're doing? Was it today, yesterday, last week, last month? I do not remember, never. How are you doing as a health professional and checking in on your colleagues' mental health well-being? Obviously, this is anonymous, no judgment, just to make us think about how we are contributing to this area. A couple of other people who can still participate, and then we can have a look at the results. When was the last time you genuinely asked a colleague how they were doing? Okay, Rachel, I think we can show the poll results now. So here we see, okay, yesterday, good majority yesterday, great. We're still in the, at least in Europe, we're still in the morning of today. So we still have time. And for many others of you joining us from other parts of the world, it's possibly very, very early in the morning. Interesting to see a few people saying last week, last month, last year, or they can't remember. So maybe we can dig into that a little bit later in the discussion. Why are we ourselves, who should be the proponents of mental health and looking after each other, not asking these questions and having these discussions probably as often as we could and should be? Now, I would like to hand over to the moderator for today, Ottmar Kloiber. He's the General Secretary of the World Medical Association. Ottmar.
Thank you very much, Helen. And let me also express a warm welcome on behalf of the World Health Professions Alliance to yet another webinar in our series of the positive practice in environments. Before I start, let me just give you a few words about the World Health Professional Alliance, which represents now more than 41 million healthcare professionals and brings together the global organizations representing the world's dentists, nurses, pharmacists, physical therapists, and the physicians. The World Health Professional Alliance was founded in 1999 with just 3 international health professional organizations. Today we have 5 partners: FDI, World Dental Federation, the International Council of Nurses, FIP, International Pharmaceutical Federation, World Physiotherapy, and my organization, the World Medical Association. Like most people, health professionals experience illness and have family obligations and other commitments outside their professional lives that can affect their mental health. Unlike most people, however, health professionals are also exposed to a particular mix of occupational pressure that can pose additional risks to their mental health and well-being. These pressures include feelings of responsibility towards patients, high expectations from the public, emotional, challenging and traumatic situations, heavy workloads and long working hours, exposure to and the fear of the exposure to biological hazards and moral injury. Exposure to verbal or physical violence is also recognized as a risk factor for poor mental health in health professionals, as is workplace bullying and harassment. And we have seen these things going up in the past years. Rates of poor mental health in health professionals appear to be increasing in response to rising demands, staffing shortages, and diminishing resources. In addition, mental health stresses have been rising during the COVID-19 pandemic, with at least 1 in 5 health professionals reporting symptoms of depression and anxiety, and almost 4 in 10 reporting sleep difficulties. The prevalence of presentism is likely increasing as well. Today, we have brought together a range of experts in mental health and the workforce to better understand what the issues are and how we all work together to support our workforce and look after ourselves. The idea is to start with a round of short presentations, followed by a discussion, responding hopefully to your questions and comments, which you can post in the Q&A section. Please don't use the chat section, use the Q&A section, and we will try to bring them up then and feed them into the discussion. But first, let me introduce our panelists. As first, Dr. Madeleine Nagler, and she is professor, and let me get back my script here. That is something that I have to put on my screen. She is Professor Emerita at the Rory Myers College of Nursing, New York University. She is nationally and internationally known for program development, publications, and policy implementation related to substance use disorders and mental health nursing. Her activities include research and curriculum design, integrating behavioral health into health professional education and practice. She includes advocacy on a policy for nurses, health and well-being, development of international consultation and education, and establishment of the Myers College of Nursing, a WHO collaborating center in geriatric nursing education. Collaboration on education and research with Pan-American colleagues. She was a National and Aging Policy Fellow 2016 to 2017, and as an Associate Director of the RMCON Center for Drug Use and HIV Research, and has been recognized for her contributions by nursing and interprofessional organizations. And let me say thank you very much for getting up that early this morning, Dr. Nagler. Second is Dr. Roshan Jain. He is a professor of psychiatry with over 22 years of extensive experience in general psychiatry, addictions, psychotherapy, teaching, and motivational work. He has worked in the UK for 15 years and returned to live and work in India in 2011. He heads undergraduate psychiatric faculty at the International Medical School, Bangalore, India, and does clinical practice at Apollo Hospitals. Dr. Jain firmly believes that people have inherent ability to heal themselves and are capable of recovery from illness and emotional difficulties when they are treated with respect, compassion, and warmth. He has worked tirelessly in reducing prejudice and stigma associated with mental health problems through speaking events, mental health awareness seminars, workshops, live TV and radio shows, and numerous publications. He has over 100 published mental health awareness and educational articles. And today, I think you are joining us again from Great Britain. Welcome very much. Third in this panel is Lauren Harry. She qualified from Cardiff in 2009 and has worked full-time as a general practitioner in Wales ever since. She bought her practice, Sparkle Dental Center, in 2017 and became a foundation trainer in 2020. Lauren's main focus for the past few years has been on helping to maintain the mental health of the dental profession. She set up a closed Facebook forum where dentists are able to discuss all aspects of mental health, stress, and crisis. Lauren is a founding member and current trustee of Confidential, a helpline providing emotional first aid and signposting to dentists in crisis. She is also a board member of the British Dental Association. Outside of dentistry, Lauren is married, has 3 young children, and quite a lot of pets, she reported. So welcome all 3 of you. And the idea is now that we start our discussion with short statements by you. We have about 20 minutes time for these initial statements. So we would like you to aim for about 5 minutes, when then Helen will raise a yellow card so that you have an indication that your time is coming to an end. And we would then like to go into questions asked this, and hopefully that our audience can write down some questions or maybe comments in the Q&A section, which then I will try to give to you, the panel, in order to discuss them. So may I ask Professor Nagler to start and to open this round?
Thank you, and good morning, everyone. It's so nice to be here, and thank you for the invitation to participate. So nurses number at the last count around 28 million around the world, and they make up 59% of the workforce. And with patients, they have been the most vulnerable, being on the front line to the COVID-19 epidemic. We've lost more than 1,600 nurses around the world. But the COVID pandemic and epidemic also coalesced some policy initiatives that had already been in the works and sort of coming together, coalescing around mental health concerns. The International Council of Nurses had just completed a revised mental health policy, which included promoting and protecting the mental health of well-being of nurses, as well as the population. And the American Academy of Nursing had just released a policy and exploratory paper on the relationship between the mental health and health of professionals and maintaining standards and quality of care. But in response to the factors created by this extraordinary strain on the health systems, nurses reported, as has been mentioned, higher rates of depression, anxiety, and those dated from Wuhan, really, from the early time, a sense of helplessness, fear, perception of threat to their own health and to the health of their families and friends. They experienced what we call moral injury or moral distress, when one is conflicted about decisions that really are not congruent with one's own ethical training. And now we're hearing reports of a lot of compassion fatigue, where people are so tired physically and mentally, they really can't feel with others any longer. The American Nurses Foundation in the US surveyed 22,000 nurses, and as high as 70 to 80% of them reported a sense of anxiety, being overwhelmed, being unable to relax. And the biggest impact was felt among nurses 34 and younger. So the promise of the future, really, young people just getting into the workforce. But the 55 and older had similar, but about half the same number of complaints. Many factors, the undersupply of PPE, understaffing, workplace tensions, the strain of the issues that have already been under review in most of our societies about discrimination, imbalance in resources and treatment, discrimination among minorities and racism had all been coming together and had stirred up action within several professional nursing organizations. So the mental health consequences certainly add to the global statistics that were already high on mental health problems. And in most countries, the government under-resources services to address these needs. In the US, it came at a time of renewed effort, as I said, to look at disparities and inequity of wealth across the country, which has resulted in extended strain to our lower income populations during the pandemic. ICN and other nursing organizations are now working on and focusing on employment policies and the need for consistent mental health funding through more inclusive insurance plans and an effort to address the needs of low-income economies. Are health professionals more at risk than the general population? Do we consider that they are a vulnerable group? We're going to talk about this a little bit, and I think we need to see it in the context of what goes on that triggers a stress response within individuals. We don't have a lot of research comparing professional group to professional group and high rates of mental health problems. We have isolated studies. But certainly among some other highly stressful occupational groups, nurses have experienced during this time of pandemic the strain of caring for many, many dying patients, caring repeatedly for patients who are dying without the support of their families, being understaffed in situations where resources are highly limited, experiencing mental fatigue and physical fatigue over extended shifts. The cumulative effects on nurses include greater exposure to vicarious trauma, repeated exposure to trauma, high rates of PTSD, high rates we see recently that have been reported around suicide, and depression that's higher than the general population. The levels of discrimination that have been longstanding in the workplace affect us all as well, and incivility and violence in the workplace seems to have risen during this pandemic. So the new focus that we plan to look at, we'll talk a little bit more in terms of organizational action and what nursing has been doing around the world to address the needs. Thank you.
Thank you very much, Professor Nagler. Dr. Jain, may I ask you to come on second?
Indeed. Thank you for inviting me for such an important international webinar. Many of you will be surprised that of the many webinars I've done over the last 1.5 years during this exceptional time, this is the second one talking about the mental health and well-being of healthcare professionals. I've done 30 plus, and most of the invites have been for looking after the health of patients, the communities, corporate workers, and so on. But very little discussion there ever is about the mental health and well-being of healthcare professionals, doctors and nurses, rightly termed as being frontline warriors. So it is as if we never did much work before the pandemic struck us, that we suddenly become the frontline warrior, equivalent to an army of people safeguarding the country, safeguarding the health, and safeguarding the people. Unlike other people, doctors and nurses didn't have the choice of getting into lockdown and walking away from work due to various reasons: moral obligations, enhanced obligations of beneficence, of doing good to society and to community. And unlike UK, I think in India, in many of the states, there wasn't an option of opting out. That if you did opt out, especially those in the emergency and pulmonology and intensive care, then you would be forced to come back to work, especially in the public sector, with threats of being struck off from the register if you didn't work. So at the time when the world was dealing with the pandemic and uncertainty and an unbelievable amount of mortality and morbidity, doctors, with all those fear and worries, were still turning up to work. And as Otmar quite rightly said, that the presentism is likely to rise. And we know that the presentism among the healthcare professionals is been rather high compared to any other profession. Data has suggested that in many countries, European Working Conditions survey in 2018 suggested that about 40% of people were turning up to work even when they were ill. And if you look at amongst doctors, then it would be as high as 80% of people have turned up to work when they were ill, physically or mentally. As a psychiatrist, I can tell you that we have been always heavily focused on body and bodily ailments, and very little to the mind or the issues of the psyche. And that has pretty much guided the way we practice worldwide, that it's all body oriented, that ailment oriented, illnesses which are visible, illnesses which are palpable, illnesses which can be detected with investigations, with an MRI scan and blood reports. Things which are not visible are not attended to as much as one would want. Consequently, doctors being not so good patients, nurses being not so good patients, would avoid talking about it, consequently quietly suffer or continue to function with those sufferings. And what we realized during the pandemic in my clinical practice is that more and more younger doctors, medical students, trainee, junior registrars, junior consultants were more willing to come forward and seek help on the grounds of being burnt out, having insomnia, feeling tense, and so on. Very few would openly talk about feeling anxious or depressed or unable to function when they indeed were feeling the same thing. We've seen a significant rise in mental health problems, consequently a significant rise in awareness of the need to attend to mental health issues. And that we've seen much more among the general population as compared to the medical fraternity and nursing fraternity, which is not good in some sense, but good from the pandemic point of view, that it has brought the mental health awareness and the need for it right into the forefront amongst all other specialties. So this gives us an opportunity now to recognize, to talk about it, to raise awareness, to involve all specialties in identifying, addressing, and supporting your peers, your colleagues with mental health problems, because with an unsound mind or with a worn out mind, there's going to be a significant impact on the healthcare delivery and on the healthcare outcomes of patients that we are meant to be caring. So as a psychiatrist, I think that we need to be focused heavily on our self-care, because if we are not healthy, then we are no good to the patients, we're no good to the outcomes, and we're no good to the organizations. So we need to prioritize ourselves over and above everything else, so that we can deliver the very thing that we have been qualified, trained, and contracted to do. Thank you.
Thank you very much, Roshan. May I ask Lauren to give her a statement, please?
Hello, everyone, and thank you very much for inviting me along today. It's a little intimidating following such wonderful speakers. Thank you for your statements so far. Dentistry in the UK has long had its issues with mental health, and in 2019, a paper was published by Toon et al., sort of describing the burnout and the stresses that are present in dentistry. And we found that dentists are more susceptible than the general population to suffering stress and burnout and comorbidities associated with that. We found that the biggest fear in the UK prior to the pandemic was fear of regulation and fear of litigation, which is on the rise in the UK. It was already quite high, but is higher now. During the pandemic, though, we found that the stats are becoming more worrying. We found that, let me just get my stats up, sorry. We found that about 43% of dentists in Wales who were surveyed, so we surveyed all the dentists in Wales, and 43% of them stated that they could not cope with the amount of stress that they were under and could not cope with the stress of their work. And going on with what Dr. Jain said, 75% of dentists reported going to work despite feeling not well enough to do so. We see that dental nurses are leaving the profession, unable to cope with the pressures of working with extreme PPE, the level of aggression towards the dental teams from patients who don't understand why they can't be seen in the manner that they were previously looked after. what can we do about it? Well, we can look after our teams. We can ensure that our teams have adequate, safe spaces to be able to talk to each other and sympathize and empathize with each other, and, you know, get the feelings out of their mental tumble dryer, rather than having them ruminate around and knock around in their brains. It's quite nice to be able to have a chat to each other and to say that I'm not the only person feeling like this, and to say it's okay to feel this way. It's okay to have moral injury. Everybody does. Dentistry is quite often sort of a little bit separate to medicine and nursing, but listening to these statements today, it's quite apparent that we all feel similarly. I created a Facebook group some years ago, which now has a following of 6,000 UK dentists, which is called, unfortunately, named Mental Dental, a group for dentists in crisis. I didn't think that it would have the sort of following that it has, otherwise I'd perhaps named it differently. On this group, dentists are able to post anonymously about the stresses that they face and are able to offer each other support. Now, I know that it's been said today that doctors and nurses are not great at talking to each other about their problems, and I think dentists are known for being perhaps worse at doing so. But this group has encouraged many dentists to step forward and say that they are in need of help and they are in need of support. I'd like to encourage dentists internationally and in fact all health professionals internationally to start talking to each other and give each other support. That question at the beginning was a very, very important question. I think that we don't ask each other how we're doing well enough or often enough, or perhaps listen genuinely enough when we ask the question. So I would encourage everybody to do that. And I would encourage everybody to just make your environment as stress-free as possible. And I know that that's difficult to do. We are in the middle of a pandemic and we are under enormous pressure, and we know that we must care for our patients, but we must also care for ourselves. And I would just echo what's been said already. We can't pour from an empty cup. If we are not well enough, then we can't look after our patients, and they need us more than ever. Thank you.
Thank you. Thank you very much, Lauren, for your statements, and thanks to the other speakers as well. I still would like to encourage our audience to type in questions in the Q&A section. If you want to be part of the discussion and the exchange, type in questions or comments you have. Same, of course, is true for my colleagues from the World Health Professional Alliance and for the speakers yourself. If you just would like to raise your hand so that you can take part in the discussion. And also, if you have a question to your counterparts in the discussion of that. But let me start off with a question related to this whole thing that we are seeing in the situation you have been describing. Our healthcare systems in the past years have been more and more ruled under economic rules, efficiency, profitability in many places. Is that something that has driven us into a wrong direction and has not helped or has been detrimental to face a situation of the pandemic? Is there any opinion by you on that question? You just have to speak because we're such a small group, and I think we can do that.
So I would mention that the corporatization of medicine has been with us for a while. And we have been dealing with the fallout around that in terms of control over our own practices and beliefs about how we should practice and the freedom to practice. But in addition to that, in the effort in our country, for example, where we have so many for-profit institutions, things are run in very strict lines about excess. So the things that were not directly correlated to getting everybody functioning at work were eliminated. And some of those were things like employee assistance programs, things like wellness initiatives. They are more and more not coming from the employer.
Thank you. Roshan, is that something you also see in your clinical environment? Stress coming up from the more economic side, which is now well, probably aggravated by the situation of higher demands, higher workload, additional stress in the clinical setting?
I think so. Yeah. So I have experience of both India and UK, as you mentioned very earlier, and the pressures in India, where there's a lot more corporatization and public and private sector. Most people in middle income or higher income group go to the private sector. They don't go to public sector hospitals at all. And there, the profitability and those things are at the forefront over and above the service providers. So service delivery and profitability is trumps the service providers and health of the service providers. Consequently, much needs to be done in an Indian setting to bring that into foray. Worldwide, as we know, the research has always been on the health outcomes, the patient satisfaction, and so on. It's never or very little about the service providers' quality of life and quality of care, and let alone talking about the mental health and well-being of those service providers, whether it's psychiatrists or any other professionals or nursing professionals. So we need to change those mindset to, as I mentioned very earlier, to turn that from the service to service providers, the one who deliver the services. We need to change the ethos of organizations in India and also in UK. And UK has got a different set of stressors. The target driven, everything is mathematical. It must be done, whether there's staffing shortages, whether there are inadequate number of staff, whether there are deficits, health issues, and so on. The service must go on and the quality has to continuously improve. So I think the stresses that I've seen in my colleagues in UK is far higher than those in India. Because the disconnect during the pandemic of the medical professionals has been far higher in the UK than in India, purely because of the sheer number of people, the way we work in the environment. I work in a large corporate hospital, which despite all the cutoff and lockdowns and restrictions, we had a reasonable camaraderie and peer support going on an informal basis mostly. So that kept a lot of us healthy and happy despite the difficulties. That won't happen here. People are withdrawn. People have been cut off for a long time. So I've seen a seismic change in the way people work, in their attitude towards their work, which is quite negative from the pandemic point of view and from the individual point of view.
Thank you, Dr. Jain. This nicely leads to a question which I had in mind, and is also in a similar way posed by Alan Bierman, asking about working conditions, organizational interventions to reduce the risk of mental health issues and promote wellness. Now, Lauren, you are representing a part of the health workforce which are working in single or in small practices or clinics. And you have been very much engaged in supporting dentists, especially who are overwhelmingly in this situation, to care for themselves and to look for their staff and for their small teams there. Are there routines you are recommending, and how can your institutions, small institutions, address those stresses in a kind of methodological way, so systematically?
I think that what we found in dentistry to be helpful is regular sort of staff huddles. So getting together in the morning to discuss what the plan is for the day, meeting up at lunchtime, everybody eating together, discussing any problems that have happened throughout the day so far. Because we work in individual surgeries. So, you know, sometimes when it's very, very busy, you might not see the other members of the team through the day. And I think that a debrief at the end of the day is also really, really helpful. So I think just several opportunities throughout the day to be able to come together and talk about issues that you faced, or celebrate the good things that have happened as well. And I think that having a policy about not viewing problems as problems, but as learning opportunities, I think that is, you know, it's a way of viewing the world through a different lens, rather than, you know, a negative lens. We can always put a positive spin on any situation then. I think that also ensuring that staff have adequate breaks and have booked annual leave, and have chances and opportunities to rest and exercise is another very important part. So if staff have long enough breaks throughout the day that they are able to go for a little walk, have some fresh air, eat healthy food, you know, so have access to good snacks, not just cakes and biscuits and things like that in the staff rooms, and have an area in the workplace where there is somewhere quiet to go if staff are having a wobble. I think that, you know, all of these things, they're small changes to implement, but they all can come together just to make the working environment that much more pleasant to be in day to day.
Thank you, Lauren. Maybe it's a factor of age, but I remember we have been raised and educated in a situation where showing weakness or fear was been seen as a sign of being weak, and it was not deemed to be appropriate. So when you had a morning briefing in a hospital and in a larger clinic, it mainly was about the work that had to be done, very instrumental to the processes that were there in the clinical routine, but it was never about the persons themselves. And has that changed? Has this check-in changed in the larger institutions, or is that something we have to recommend much stronger? Professor Nagler, Dr. Jain.
So I would say we still lack a positive sanction for dealing with personal issues in a workplace setting. Nursing is a highly diverse profession, and given our numbers and locations around the world, every culture, ethnic group, gender have different styles of how they come together and create colleagueships at work, but they certainly do. And one of the ways in which they have been dealing, I've been hearing, with the stress of the pandemic is by taking some of the opportunity they have at coalescing and in collective action to make decisions. So I heard a great example from Argentina the other day about how in a field hospital, the nursing staff came together and they all decided how they were going to work their days off, but they were all going to make sure that they all got days off, that they looked out for each other in that way. Another situation where many nurses were part of a union within a community health system, and where they bargained with management and to find ways to support them, whether it was time off, whether it was the benefit of access to supportive sessions or hazard pay, we call it. Efforts were done collectively to try to leverage the system a little bit.
Yeah, and yeah, just to add on to what Madeleine said, very important points of what she's trying to say is to connect during this difficult time. And while we might be professionally working together in hospital or from home, we need to connect otherwise as well. And I was telling my colleagues the other day that in the Indian setting, we have enormous amount of social media groups, for example, WhatsApp groups for colleagues at work, for psychiatrists, for professionals and management, and so on. There's WhatsApp group for everything. WhatsApp group for families, several. There's none in the UK. Even my ward staff where I'm working at the moment in Leicester has no WhatsApp group. There's no doctor's WhatsApp group or social media group. There is no communication or connect. It's almost as if people are shutting off from each other, not wanting to, whether that's avoidance of speaking of what they feel and what they're experiencing, or whether it's something else. I fail to understand that. But these groups, and whatever the ails of the social media might be, has done many of us a lot good. When we could, we meet in person through the social media groups, and when we can't, we still have a conversation and chat going on. And that's been forever since the social media came out in India. The connect is completely different. In Apollo hospitals, we have a very large Apollo Hospital Consultant Forum, which is connected through various portals, medias, and we are in connect with everybody. Often the patient feedbacks from Apollo Hospital is that when they come to Apollo, they feel as though they're part of a family, that multiple specialty doctors coming and see a patient, they don't feel that they're working separately. They feel as though they're all one team, whether it's orthopedics and psychiatry and psychologists and nurses. So that feel, the person is catered for all under one roof by various peoples in a very coherent fashion. One of the things I want to raise at the point is that I really enjoy seeing that the positive practice environment is otherwise termed as PPE, which is like a personal protective equipment. And the PPE simply is, this is our own PPE. We need to develop those PPE. And I was reading through the PPE document of positive practice environment, which is essentially healthcare settings that provides excellence and decent working conditions. But I was writing down things from that to say that, in my opinion, PPE is nothing but an environment which is conducive, coherent, and caring, and conducive not just to good environmental conditions, but in a condition where there is recognition and value to who you are as expertise, and autonomy to deliver those skill sets, and to get a continuous appreciation from your organization, but also from patients. It needs to be cohesive in terms of, to appreciate the workload and training and the rising difficulties, and it needs to be caring so that it can attract more people, and it can provide, and those people can provide quality care. So coming down to that, to say that I think we have to engage in our own self-care. Professionals often talk about professional development, but we don't talk about self-development and never talk about self-care. And to me, self-care is simply two facets: passive self-care, where you just retire, take breaks, take holidays, and so on. And active self-care, wherein you do meaningful activities, meaningful hobbies, meditating on a regular basis to introspect and get a deeper grounding, to engage in fitness. So these two self-care, passive and active self-care, is two things I always promote for people, putting yourself at the forefront.
Let me respond to this directly, Dr. Jain. During the pandemic, we have seen in the beginning a lot of cheering and applause for house professionals. Unfortunately, this did not translate into any actionable items and any really reward for the work that has been done. Well, there have been some bonuses, which in some places may have been paid, but actually that was merely tokenism. What we have seen, there have been no real changes and no real respect for the work that has been done in clinical settings by all of the health professionals. So there certainly is this deficit that is there and that has not been taken care of, and I think we all have to work for that in order to make that happening. On the other hand, I would like to tell you that, there is the Declaration of Geneva, the modern form of the Hippocratic Oath, and it was revised in 2017, so before the pandemic.
Yeah.
And, what has been added in that was an obligation to self-care, to look after your own wellness and your own health.
Yes.
This has different dimensions and aspects. One, of course, is to be able to provide healthcare in the first place. If you're not healthy, you cannot do that. It has another aspect that is, of course, being an example for health, because we know that the health of the health professionals precedes the health of populations. And third, it is also a protection against being overcharged by your employer, by the demands from public, and then say, okay, wait a minute, I'm also there. And that's it. So I think there is change in that, which is positive, but I would also agree there is much more that has to be done. Now, let me take this little break here and go to a question that has been raised by our audience from Tiziana Sala de Filippis. I hope I pronounced that correctly. She wrote, Professor Nagler addressed the phenomenon of moral distress and moral injury. I was wondering if pandemic worsened the phenomenon in terms of intensity and frequency, and if yes, is she aware of extra measures put in place in order to support health professionals in this respect? Question in first place directly to you, Professor Nagler, but to the others certainly as well.
Mm-hmm. It's a great question. Recognizing that moral injury and moral distress is occurring can sometimes be difficult because for the very reasons that have been mentioned, the problems of connecting. Decision-making under pressure is done very quickly in intensely stressful clinical settings. So in intensive care units, in emergency rooms, where there's tremendous pressure for action. I do a lot of work with older populations. I've heard that some very disturbing discussions and actions have been taken around older individuals who were not treated at all for COVID because they fell into an age group. So when it came to rationing the resources and the care, the civil rights of older adults were not respected. So under those circumstances, how do we help and support individuals who are struggling with those issues? And what are their reference points? So to go back to Dr. Jain's point about teams and connectedness, when we can pull teams together where there is some discussion about the moral guidance, the cost benefit, the families involved, all of the factors that lead to the decision of, do we move this individual out of the parking lot and into the intensive care unit? And some of those decisions were made on the ground very frequently throughout the world.
Thank you. There has been another question from James Watterson. He asks, is mental distress that leads to leaving the profession generally more due to specific events or to attrition? Is that something you have observed? It's probably different in hospital settings than it's probably in single practice. I guess what I have seen from numbers is at least there is a high attrition, for instance, with nurses. At least in our part of the world here in Europe and Central Europe, what we see is nurses are well educated, usually very intelligent persons who have an easy way of finding another profession or another job. It may be a little bit more difficult for a practice owner, him or herself, to drop out and to do something different. But is that something that you also have experienced on your horizon, seeing attrition, dropouts, other things?
In the Indian setting, I think there's been an extreme, as Otmar mentioned earlier, an extreme sense of gratitude and appreciation during the pandemic and the clapping and all the public display of appreciation, to another extreme where there was enormous amount of distress, where healthcare professionals were getting assaulted, where the mortality and morbidity rates were very high, the individual and family stresses were very high, and when patients die, in hospital, then there was a lot of violent incidents in the hospital or in several states on several occasions. And that had led to an added distress of working and pressures and workloads and pandemic. Many doctors were leaving the profession or contemplating leaving professions and wanting to get away, to be unable to handle this moral dilemma between the duty to provide care and the need to provide care and an appreciation of care that you're providing. So that sort of attrition and that sort of desire to leave the profession has risen significantly in an Indian context more recently, amongst many other factors. I don't think that's turned into people actually leaving the profession, but many are thinking about it to say that is it worth it? Are there other things that we can do?
Thank you. Just another question from James Watterson, perhaps a very short answer, whether there is some work that has been done, quantitative work on nurses or other clinicians leaving profession due to involvement in sentinel events and medical error. I'm personally not aware of quantitative studies on that. Is any one of you aware of that? Obviously not, but I guess it's something that should be done. Now, let me, all three of you ask for a last final statement, and to that I would like to give you a question is, what do you expect from your professional organizations on the national and global level in order to bring mental health more to the forefront, mental health of the profession? If you could just give me one phrase on that. May I start the reverse order with Lauren first?
Awareness. I think it's just one word, is awareness, or raising awareness. So repeated social media campaigns, repeated stories in the media, talking about the mental health issues that all of the medical professionals are suffering, and raising awareness and encouraging mental health to be sort of at the forefront of everybody's mind.
Thank you. Roshan?
I think, again, as Lauren said, awareness and mostly education and training about the mental health. And I think when all medical and nursing professionals and other healthcare workers are sufficiently educated about the mental health issues that can affect all of us, only then they will be able to recognize their own problems and recognize those of their loved ones. And I think the training deficit or deficiency is enormous, especially when it comes to mental health among general medical professionals. So I think we need to use pandemic as an opportunity to now bring mental health training right into the forefront of all continual professional development activities.
Thank you, Roshan. And Madeleine?
I would certainly echo that. This is an opportunity within this crisis to really push mental health forward. In nursing, we do expect some action, and we want to build on some of the initiatives that have already begun. I think we've done a pretty good job raising awareness through the International Council of Nurses, through the American Nurses Association, the American Academy of Nursing. There's a great deal of discussion of opportunities for intervention. One of them being educating from the very beginning students that self-care is important, that they can't deliver quality care if they are not in good health themselves. Starting with education, but also beginning to broker more aggressively with employers, with institutions who tend to set standards for those opportunities for self-care. We would like to have more input into opportunities for self-care in the workplace around the world for nurses.
Thank you very much. This gives me the opportunity to ask my colleagues Howard and Jonathan as well. As you know, we have been crafting together in this group of several health professions organizations the PPE campaign. By the way, that was long before PPE became a very important issue last year. But something that we found already a decade ago of being extremely important to improve the workplaces and the quality. I know that both the International Council of Nurses and World Physiotherapy have done a lot in their professional groups in order to address that. So I would like to take this opportunity to give you also a chance for a last word here. Howard, would you like to go first?
Otmar, thank you very much. And let me just particularly thank Lauren, Roshan and Madeleine for some wonderful, thought-provoking and insightful contributions. Just a couple of observations. We have got some evidence coming through of increased intention to quit rates as a result of the pandemic, and there's some information on that on our website. And I think, you know, highlighting the impact on retention is a huge issue. I thought that Roshan and Madeleine and Lauren, I thought it set out some really excellent examples of the complexity of the issue we're dealing with. There were just two very briefly I wanted to add onto the table, because I think we're picking up and also giving a lot of thought to as well. Talking to nurses who you then have an assumption that they're getting support at home. And I've had it now on a number of occasions where those nurses say, I don't talk about this at home. My family are worried enough about what I'm going through and the impact of me. I'm not talking about it at home. And so you imagine that nurse who's come off that shift, or that healthcare worker, they're not going to go home to talk about it. Before they even get home, they then face the anti-vaxxers outside their facility saying, it's all fake, it's all facts, you know, it's not true. That level of complexity around the mental health and psychological pressures. The issue that I think that we're also now thinking of is that, in addition to all those wonderful examples that were given about what we can do in the workplace, do we not need to also be thinking about what do we need to do to extend beyond the workplace to support people at home, and how do we address, and whose are the responsibilities for, you know, beyond the professions, but for employers, for governments, for civil society as well, in terms of some of the anti-vax and misinformation issues as well. So I just wanted to put those also as issues which are coming through, that I'd be really keen to hear people's thoughts and views on. But thanks again, everyone, for a great session.
And thank you, Howard, for these comments. And Jonathan.
Thank you very much. And I'd just again like to echo my thanks to the panelists. It's been a really nice time to just sit back and reflect and listen. So thank you for giving me the opportunity to do that. I think as leaders, it's important that we model good behavior in this domain as well. And so taking time for our own mental health and making sure that we're looking after ourselves, which I know has been mentioned before. And one of the things which it came up in the chat, you know, what's something concrete that I can do? And for myself, this year I did some mental health first aid training through there's a program here in the United Kingdom, and I just would like to, if they're available in your location, recommend that people consider doing that, because certainly I'm a physiotherapist, I'm not a mental health professional, but just giving me the tools so that I can have the conversations with my friends and colleagues around some of these issues has actually been quite liberating, because often we're like, I don't know what to do, and this is too scary a conversation to start. And I think that just having some tools where you can enter into that conversation, I think is really useful and help to direct people to the resources that they need. So Helen, I think, is taking some notes, so we'll be able to share some of those information about that. But thank you once again for the panelists. It's been a great webinar. And
thanks to you, Jonathan, as well. So that leaves me with wrapping up this session here. First of all, let me thank to our speakers, Lauren, Roshan, and Madeleine, for being with us, even at a very early hour in New York. Let me thank also my colleagues at the World Health Professional Alliance from the other professional groups, especially here also to Helen and Rachel for excellently preparing this webinar. Please have a look on our website from the World Health Professional Alliance. We have already some materials in the PPE campaign that is there and ready, it can be used, kind of toolkits, advocacy material that we have already provided. Certainly with the experience that we have made and with discussions like this will develop and certainly will have a further step of extension and development into the mental health area of the health professions. Thank you for your engagement, and I head back to Helen or Rachel.
Thank you very much, everyone. Today, we've just gone a little bit over the hour, so apologies for people who have to rush away. Thank you again, everyone, speakers, moderators, Rachel, for your help setting this up, and everyone who contributed with the questions and answers. As just a final note, the conversation doesn't stop here. As Otmar said, we have a website where we have some resources. We'd love to hear from you, ideas, your stories, your tips for maybe something that you've implemented in your own workplace or in your own work routine that has helped you with your own personal mental health, or something you've heard about. We'd love to collect some of those case studies and be able to share them. As someone mentioned in the chat, it's the awareness is getting there. We need to continue that, but maybe now it's time for us to start with the action. And what I find most useful is concrete things that we can do. So sharing those little pieces of advice from the panelists today are really useful things that we can implement immediately. So please, if you do have any other suggestions, please share them with you. Thank you so much, everyone. Keep well, keep safe, and we hope to see you again soon.
Bye-bye.
Bye-bye. Thank you all.
Thanks all.